I thought I would speak about the responses that Singapore or other countries have put in place for COVID-19, but to angle it around what we understand as public health academics and public health practitioners. And that's why I specifically titled this really looking at the response to COVID-19 from a public health 101 perspective. What are the foundations and the basics in public health that we should be thinking about? Now, clearly, when it comes to public health policies, it has to be evidence-based. We don't just make policies out of thin air and then think that it will work. We really look at evidence. There's a lot of focus and emphasis really on prevention and on thinking about how systems really come together to avoid an explosion of cases. And when I talk about systems thinking, it means that it goes beyond just a health system thinking, but it also includes transportation, the environment, finance, labor. All of these pieces have to come together, particularly for COVID-19, where we see foreign relationship travel, international travel being one of the major drivers for COVID cases to take off in Singapore. And really this public health focus a lot on dine and save. What is dine and save? Dine really talks about designing policies, programs, implementing these policies and programs, and more importantly, monitoring them and evaluating them to make sure that they are actually effective and useful. That is what DIME is about. And of course, sustainable policy making as well. That when we think about public health policies, a lot of it is grounded in sustainability, making sure that it is adequate, it is enough, that the measures are useful, it is fair, that there is a fair and equitable distribution. And finally, it has to be efficient. It cannot bankrupt a system. I can talk about bankrupting the system later on when it's specific to COVID. And then it's public health really has this cross-disciplinary systems thinking, and it's very much outcomes driven. So I'm going to show 5 boxes, and I see this as always the building blocks for a sound public health policy thinking. That we need to think about what is the evidence in the first place. We need to look at what is the impact, what is the effectiveness of some of the policies that we put in place, whether it is how do we communicate and how do we engage the media. And before I talk about the last, I think one of you need to turn off your microphone. I can hear myself in an echo. Yes. So I think I know who it is. Good morning. Good morning to you. Right. And the last is really around systems evaluation, that we need to see whether, from the health system perspective, do we have the appropriate setup involving primary care, involving tertiary care. And when I talk about systems, I thought it would be useful just to very quickly show what generally does a health system look at in terms of all the different pieces. This is what a health system really is about. There is primary care, tertiary hospital, long-term care, palliative care. And when we look at COVID responses, whether it is in Singapore, in Taiwan, in Korea, or in other parts of the world, you would see different population segments coming into play, because how we handle schools will be very different from how we handle the elderly care centers or the elderly care homes. What do we do in working environment, the workplaces? Again, very different policies that needs to be put in place. Now, I talked about outcomes earlier on, and this is a list of 8 outcomes that I think countries need to really focus a lot on, because there's this global emphasis on counting cases. Like America has 30,000 cases yesterday, India has 70,000 or 80,000 cases yesterday. But those cases numbers don't really matter that much, because at the end of the day, we know the number of cases that the country sees is a function of how many tests that they perform, and to what extent are they surveying the right groups of people. It is around how quickly you are able to isolate groups of people to minimize deaths and complications. Very important in protecting your healthcare workers. Are you able to provide the necessary financial coverage for people who are affected by COVID-19? Some of these are the key aspects of outcomes that really matters a lot. Now, what happens when we don't focus on outcomes, but we focus on inputs? And this is really where this slide on benchmarking global health security is relevant. And if you look at this slide, this was a report that was generated and published worldwide in November last year, in 2019, before COVID struck. And I think that there is a lot of internal, inward retrospection that academics, all of us in the global public health community, needs to think about when we produce a report that looks like this. America is ranked to be the number one country in terms of pandemic preparedness. The UK was ranked number two, Australia, Canada, Netherlands, Thailand, Sweden, South Korea, France. Some of these countries are all in the top 10. But I think right now, if I show this, this is as of August 20th, the list of countries with the worst outcomes or the worst numbers, including death numbers in the world. We see US, we see the UK being featured in the top 12, top 15. So really, when we start to think about global public health, it is not about input measurements. It is always about outcomes driven and how prepared a country is. And how prepared a country is goes beyond just documentations, which is what that Global Health Security Index relied a lot upon when they did their ranking. Now let's focus a lot more on COVID now. I showed you the 5 key blocks of around the foundations of public health. The first was around evidence generation, around the synthesis, the use of information, the collation of information. I thought it's useful to just highlight that what we understand about COVID-19 continues to change over time. Early on in January, we thought that it would not be possible for humans to humans transmission. We thought that even if it is possible, the chance of that happening is very low. We thought that asymptomatic infection is unlikely to happen. But if you look at just the different degrees of evidence, whether it is on aerosolization, whether it is on mutation of the coronavirus, the way that it is transmitted, right now there's even the suspicion that it can be transmitted through food packaging, particularly on chilled food, schools, and then recently on reinfection risk. The evidence keeps changing. The question to a public health community is, are we staying on top of the change in evidence? The next is, how do we make use of all this evidence to craft our policies? Are we able to imagine or to project or to forecast what would closures of schools do to a country like Singapore when we use that as a way to reduce the spread in Singapore? What does having an outbreak in the migrant worker dormitories look like if we were able to put in place certain measures? How does shutting down transportation network, particularly around international travel, will that limit the spread in Singapore, in Taiwan, and in other parts of the world? We need to really understand what is the impact of our actions before we go ahead with it. And I think this is one of the important aspects of public health. The next is really this emphasis on monitoring and evaluation. I can put in place all the recommendations around mask wearing, around social distancing, around making sure people don't crowd together in restaurants. But at the end of the day, am I monitoring the outcomes carefully? And I see this to be the difference in some countries who have done exceptionally well and some countries who have put in place very good measures. But because they don't really monitor, they don't enforce, they don't penalize people, they don't penalize workforces, If people still come together in groups of 10, 20 for meals, if people still don't practice safe distancing, they don't wear their mask, there is no penalty at all. Over time, everyone will take the easy way out. I will go out, I won't wear my mask. I will go for meals with groups of people and I don't worry about it. This monitoring and evaluation aspect is extremely important because right now, worldwide, we can see the World Health Organization has been advocating the same advice to every single country. But why is it that some countries are able to manage it better? Some countries are not able to do it well. I see this monitoring, the enforcement, and the will, the political will to actually put in place penalties to be one of the key reasons why countries have done well compared to others. We have heard a lot from DG Wang around communication strategies, also from Professor Kim around communication strategies in Taiwan and Korea. Similarly, communication, not just to the public, but equally to even doctors, the healthcare workers, and also to policymakers, it is a very crucial aspect of a crisis response. So are countries able to have a trusted way of communicating both to the public, to the employers to make sure that they put in place the necessary rules to minimize infection at the workplace, and also to the policymakers who are making the decisions? And finally, around systems level considerations that marries private healthcare with publicly funded healthcare, that marries primary care, tertiary care, long-term care, such that, and also health promotion, such that there is really a single push towards addressing some of this issue. The health systems approach, evaluating and making sure the priorities are set properly. I talk about financing being one of the main impetus of how countries are able to catch cases early because people are willing to come forward to say, I'm ill, but I know that I have a financial safety net, that I don't have to face catastrophic poverty because I need to seek healthcare. Right now, in early days, the United States, it was announced that actually just treating the cost of just treating COVID-19 infection is going to cost an individual in excess of 50,000 or 80,000 US dollars per individual. That is a huge bill for an individual to pay for an infection. So this is why I mentioned that at the end of the day, when we think about a country's response, I don't want to go too far from complex public health issues, but let's just come back to the public health fundamentals. I call it Public Health 101. The outcomes that we always think about in terms of monitoring and evaluating the outcomes, the DIME approach that is always forms the basis of public health is very important. I have this bubble here that says having 0 cases during a complete lockdown doesn't say that a country is coping well. It just means that you are putting in place a very harsh approach. It kills your economy, it kills businesses and jobs, but it protects everyone. But that is not a sustainable solution. And this is why, again, that issue around sustainability matters. So I'll just end off with these 3 points. The first point is that when a country responds during a crisis, whether it is a COVID crisis or in future it could be climate change crisis, it is all about the decisions, the preparations that people have put in place, the country has put in place in the past. You have to invest in it. Secondly, I talk about this global public health. It cannot be left to chance because a lot of the investment has to be made during peacetime before the crisis happened. And very importantly, these collaborations between the academic sector, people like you and me, as well as with the government, it's something that is very crucial to develop. And the last is that when we are talking about crisis, it is the outcomes that will fundamentally matters, and it is not all the peacetime indicators that we have, like documentation. Documentations may not mean much. So with that, I will just end off with that. Over back to you, Professor Betty. Thank you very much for the invitation to speak.